topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, New York. Welcome to another Ask the Expert show, where for the last 16 years, we have brought you the top experts in the field of legal, health, financial, and home improvement. I'm going to share something with you. About 6 or 7 months ago, we had a opening, which we rarely have in New York. And I looked at the letters that we got, and it was people asking us to ask at a Medicare show. And I looked at YouTube to see other Medicare shows, and I was shocked that there weren't very many of them. And I made a decision, we're going to add an expert in Medicare for our New York area. It was a small opening that we got. We found one of the top agents in the New York area with Alcorn Associates, Dan Alcorn. And I'm going to tell you, it was God sent, because the information Dan will be sharing, has shared with you, and will be sharing with you today is so important. And I know because I'm on Medicare and I got to see the bad side of Medicare. And I hope one thing that you get out of this show is not to try to do this yourself. You need a good agent like Dan Alcorn. Good morning, Dan.
Good morning, Steve, and thank you for having us. It's 24 degrees up here in New York, but this is a hot topic, as they say, Medicare. What's today? Medicare Wednesday. So thank you for having us.
Dan, I got to tell you, I guess I am the perfect host for this topic because I went through so much hassle, and I thought I was the only one, Dan, that, God, how did I not know about Medicare? And now I see so many people with so many questions, but the bottom line is you've got to have a good agent like Alcorn and Associates.
10,000 people are turning 65 every day, Steve.
Wow.
So, are eligible for Medicare, but many are working and not sure, are they required to enroll in Medicare or not? And the government does its very best to complicate this. So we like to say we try our best to uncomplicate the complicated. So the first few months of the year, we were assisting hundreds and hundreds of individuals get acquainted with their new plan that took effect January 1. There were some opportunities during those first few weeks and months to make a change if need be. Fortunately, our clients are all settled in for at least the remainder of 2026.
Right.
This month in March, New York State issued some new eligibility guidelines for something called the Medicare Savings Program. And so scheduling with you was so timely because we have some new information that will help many New Yorkers with the cost of Medicare. And, there's an affordability issue nationwide. And that's why we were really thrilled to have the opportunity to talk with you about that this morning, the Medicare Savings Program.
Dan, is this like a last minute thing?
No, it's been there for years. It's partnership between the federal and state governments, but the eligibility standards are dependent on the government issuing the federal poverty levels and the like. So New York and other states have to wait until those numbers are released. And so, we find ourselves in the autumn during what's called the annual enrollment period. We find ourselves not knowing what the Medicare savings program's details will be until, after the new year has begun. And so these were just, as I say, released in March. And so we like to get out and let as many people as possible know that, there may be some help with some of these Medicare costs, because Medicare is not free. There is no, it's free. There are some costs and some responsibilities, for co-payments and the like that some people may be eligible for, but not aware of. And so we find that our throughout the year to educate, to be informed is to be empowered, right?
Absolutely. Well, before we get started, tell people about Alcorn and Associates.
Yes, so we're based in New York. I am a general agent and have a team of agent advisors who cover from the Canadian border to Long Island. We are all independent. We're not employed by any governmental agency or any insurance company. And, we represent Medicare Advantage, Medicare Supplement, Part D prescription drug plans. Several of our agents have appeared with us on this show from the Canadian border to Long Island. And so as a group, we cover, the entire state. Many of us are licensed in other states, like your home state of Florida, but the adjacent states of Massachusetts, New Jersey, and the like. We cover the national companies. I like to say them alphabetically so I remember them, but Aetna, Blue Shield, some local companies in New York, Humana, which is very popular in the southern states, and of course the biggest, United Healthcare.
I got to tell you that a lot of the emails we get, people see these national commercials, and they don't understand that. First of all, if you call that company, this is what makes Alcorn Associates so special. If you call one of those companies, all they're going to give you is information on that company. You've got a lot of different companies that you represent.
Exactly. Yeah, we are independent. We're not allowed to use superlatives like better or best, but we try to match each client's individual needs to the plans that are available in their county, which can differ. I mean, the plans that our agent Alicia offers in Long Island could very well be different than those offered in Buffalo or in the upstate. And we have many clients, Steve, where the spouses are on different health plans. Why? Because your doctors, your medications, your upcoming health care needs may differ quite a bit from your spouse. So I always say to folks, your brother-in-law in Texas who says you need to do this, I'm like, well, that's true. Yes. If you live in the same county, have the same doctors, the same medications, and the same, health needs. Like, no, healthcare is personal and it's local. You're exactly right. You need to look at the broad. Now, as a disclaimer, we don't represent every company. You encourage folks to go visit Medicare.gov or call 1-800-Medicare to get access and information about all the companies. But as an agency, we screen and interview and filter out those plans or those companies that best match our clients' needs. For example, there's a company, ABC, because we don't want to use one in particular, that's a national name, but they may not have a contract with the local hospitals and doctors groups in this market, but they may where you live, Steve, but they don't here or down in Long Island or New York City. So that's when I say healthcare is personal and local. Your local representative agent is informed as to what is happening between the insurance companies and the local providers in your market. And that can change. Interestingly enough, I was reading last night that on the federal level, the CMS, Center for Medicare Services, is looking to allow members what's called an election period if their doctor exits their health plan. That would be really a significant change, because right now, if you sign up with a plan through the remainder of the year and your doctor leaves that plan in the middle of the year, that's not giving you an automatic opportunity to change your plan. The federal government's looking at changing that, and I applaud that, by the way. So,
well, let's get into this Medicare savings program. Tell people all about it.
So what it is that with Medicare, you have a premium. Medicare comes in parts A and B. Part A, you've been funding that through your payroll withholdings all your working life. Part B does have a monthly premium that typically is withheld from your Social Security benefit. That's $202 a month. If I may, we have some information on our website, www.dgalcorn.com. And I think I can bring that right up here. Just bear with me a moment.
I think we've got Flo here too.
Can you see a screen, Steve, that says changes to the New York Medicare Savings Program? Yes. And again, it's at dgalcorn.com. If you go that, just in the upper right corner, there's a little search button. Click MSP for Medicare Savings Program, and it'll walk you through. There's a little video on what that works at. But here we go. If your individual income is below, well, let's just say roughly $2,500, it's actual $2,494, you are what's called a qualified individual. And what that means is, in New York State, you will no longer have to pay that Medicare Part B premium, the $202 that I've just mentioned. And if you're activating this Medicare Savings Program mid-year, you may even be eligible to have 3 months of that $202 reimbursed to you retroactive.
Wow.
If you back to the beginning of the year, the first 3 months. So that's really powerful. Qualified individuals get that $202 reimbursed to them. In addition to that, you are also automatically receiving what's called Social Security extra help. And what is extra help? So a qualified individual gets help with that Part B 202. And you may not even know that it is being withheld from your Social Security, Steve, because you don't really see it, right? You just see the net amount that's credited to your bank account. So that's after Social Security takes out that 202. Qualified individuals don't have that 202 paid for. In addition to that benefit, they are enrolled in Social Security extra help. And what is extra help? That means that your drug coverage is also assisted. There could be a drug premium, a drug plan deductible, and drug kit plan copays. So we just think that if, there's so many individuals with incomes below $2,500, and as a couple, by the way, that's $3,375, that are unaware of this benefit, that could realize, $202 a month more cash flow, and also get some help with their drug plans. Further, and it's like peeling an onion, if your income is below $1,856 or $2,500 as a couple, not only do you get the benefits of the QI, it goes even further. You'd be enrolled in what's called the Qualified Medicare Beneficiary Program. That's a mouthful, but it's called QMB. And like the other program, you no longer have that Part B deducted. but it also picks up part of your Medicare costs. So like a deductible with your health plan or cost sharing. You know, you're enrolled in Medicare, Steve. You likely, when you go see a doctor or clinic or lab work, you may have some co-pays.
Yes.
Those who are enrolled in the qualified Medicare beneficiary program, you say, well, Dan, look, you're saying Medicare savings program, QI, QMB. That's a mouthful. Think about it this way. The Medicare savings program is the umbrella. And then as you peel the onion back, the Medicare savings program is the umbrella that is managed by your state's Medicaid program. Is this Medicaid? Not really, but it's managed by the Medicaid department in your state. The very first outer layer of that is called the QI, the qualified individual. If your income is even lower, you then get even more benefits as a QMB, qualified Medicare beneficiary. And it goes even further that if your income is lower and you have minimal assets, you may in New York be eligible for what's called full Medicaid, which includes transportation to and from medical appointments and dental and visual allowances that are approved by your state's Medicaid office. Individuals at that level are also eligible for these dual plans called Medicare and Medicaid. So I know it's a mouthful. It's a lot of alphabet soup going on here, but the Medicare Savings Program, MSP, determines if you're eligible as a qualified individual with your income below $2,500, or even further, qualified Medicare beneficiary with your income is below $1,856, or full Medicaid if your income is below that and you have minimal assets. It's a great benefit to folks and not widely known. Yeah.
We want to say hi to Flo. She's just joined us. Good morning, Flo.
Good morning. How are you?
Flo's out on the road. She's serving clients.
I'm out on the road. Yep. So I wanted to make
listen.
a comment.
You have caused all kind of chaos here, Dan. If people see I keep looking to my left, I'm looking at my phone. We are being inundated by people with basically two of the same questions. One is it hard to qualify? Number two, how come my agent hasn't told me about this?
Well, if I can answer the second one first, because they haven't spoken with Flo. We really consider it our mission, all jesting aside, to educate our clients on what's available. And we don't determine whether they're eligible, but walk them through what's out there, what they may be eligible for, and then guide them to where they can get that benefit. On this page that we were just looking at, Steve, you go further down, there you go. The application is right there, and all of the eligibility requirements and where you actually submit that application. We can go over that in a moment. Flo, you had a point something you wanted to bring in? Did we lose her? Flo? Well, let's pick it up, Steve. So the eligibility is you've got to prove a couple.
She's there.
Yeah, we have to prove a few things. And so, yes, if your income is below that level, in New York State, the eligibility verification and enrollment is done through your through your county Office of Social Services. And it's rather simple. First of all, on our website, again, the application is right there. You need a copy of your Medicare card, front and back, proof of your date of birth, driver's license, birth certificate, passport, or New York benefit identification card, which would be like something for food assistance or the like. Excuse me. Proof of residence, because you have to show that you really do live in New York State. Utility bill, tax record, mortgage statement, something, confirming that. Proof of income. Now, many folks only have Social Security income. And so your award letter that comes out at the beginning of the year showing what your benefit will be before any withholdings, we encourage our clients to hold on to that. But including anything like pension information, taxable income is what is being looked at. So if you, as I like to say, if you have money in the bank and you're withdrawing a certain amount each month, that's not necessarily taxable income. That's your cash. Here's a key point, Steve. If you are paying for a supplemental plan or an advantage plan or some other healthcare plan, you can deduct that plan's premium from that income. And that premium may be high enough that alone that then qualifies you for the Medicare Savings Program. So remember earlier I mentioned at the top, if your income is less than $2,494, well, imagine if your income was $2,600 and you were paying $150 a month for some health plan. You take the $150 from the $2,600, you qualify. See how that works? Yeah, that's really quite, and a lot of folks don't realize that. They say, well, my income is over a certain amount. But you want to make sure that if you're paying for a supplement, advantage, drug, dental, vision, or even a long-term care policy, you subtract that from your income, and that may help you. And then, of course, on our website, we've got a list of the county offices where you would bring this paperwork to. And people are pleasantly surprised that they can get that 3 months worth of that $202 reimbursed, retroactive reimbursement to them.
I got to tell our listeners this is such important information. I am going to replay this show the last Friday of this month at
You lose you, Steve?
So let me try to pick up where Steve was saying. He's going to replay this show. Sure. If anyone missed anything, there he is.
There we go.
There he is. Dan, give people how they can reach you.
So our phone number is 518-346-2115. You can connect with any one of our agents through there. The receptionist can get you to an agent in your county from the Canadian border to Long Island Metro. As you can see, Flo is on the highway now. She's covering Saratoga up to the North Country. No snow on the ground up there. Flo, can you, if you can turn your mic on, you wanted to ask a question or make a point?
You got about 30 seconds left.
Well, just that if you do see an ad on TV, call your agent first, or better yet, call us. We can explain the ins and outs of really what they're trying to do. So.
Beautiful. And like I said, I don't know if you heard this, Dan, we're going to replay the show the last Friday of this month at 2:25 Eastern time. Dan, great information. Thank you so much, and have a wonderful week.
Thank you, Steve. Thank you, Flo. Good luck out there. Be safe.
Thanks, Flo.
Bye, everybody.
All right.
Thanks.
Have a good day. Thank you, Steve. Bye for now.
We're going to go to a break. We'll be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.